Well, the government says systems are running smoothly on healthcare.gov as more than 1 million visitors flooded the site this weekend. But with the healthcare.gov glitches fixed, will that be enough for people to sign up? Joining me now is California Congressman Adam Schiff, a senior member of the House Intelligence and Appropriations Committee. Thank you so much for joining me this afternoon, Congressman.
Great to be with you.
So let me just get your initial reaction to this latest development. The administration announced that people now have through the end of the day tomorrow to sign up. Is that wise, or does it add to the optics that this rollout has been botched and confused?
I think it really is probably both. It is wise because there are still some long wait times as people try to sign up on this last day of enrollment. At the same time, when the administration has to continue making these changes, it does signal that there are still problems they're working through. And I think the reality is that that process of working through those problems and a reform of this magnitude is going to take weeks and months ahead. So we're not through probably those changes. But I think it did make a lot of sense. If people are affirmatively trying to get coverage, they shouldn't be penalized because it's still, hard to get on and long wait times. So I think it makes a lot of sense.
Well, and Congressman, forgetting about the politics for 1 second, on a practical level, do you worry that this just further adds to the confusion amongst consumers?
It does add a little bit to the confusion, but we're only talking about a one-day extension. So I think that's something that consumers can pretty easily grasp, and we'll be thankful that they have. As you were analogizing earlier, it is a little bit like having an extra day to do the shopping that you didn't get done. Only the importance here is so much greater because it means whether you'll have coverage on January 1st or not. So I do think, there are some definite costs and benefits here, but I think it makes a lot of sense at the end of the day.
When you look at the polls, one poll just released today shows that a vast majority of Americans are opposed to this health care law. What does the administration need to do to start to turn this narrative around? And within that context, how important then is this deadline?
Well, I think the proof is going to be in the pudding. The proof will be in terms of what these health plans offer, what the exchanges ultimately deliver. That's going to be probably more important than the administration's rhetoric. They do need to have a consistent line about this and talk about how they're expanding coverage to people, how they're containing health care costs. There are a lot of good points to make, and I think you get a lot of sense of that when you look at the fact that if you ask people whether they approve of what's in the reform, whether they approve of extending coverage to those that have pre-existing conditions or keeping their kids on their policy till they're 26 or providing better prescription drug coverage for seniors, people want everything that's in it. But when you ask them, do they like Obamacare, they say, no, they don't. If you ask them, do you like the Affordable Care Act, more of them like it than like Obamacare, even though it's the same thing. So clearly, there's a big communications job ahead of the administration, but ultimately, it'll be judged on whether it delivers. And that's less a communication problem and more substantive policy issue.
Congressman, how concerned are you that Democrats could lose control of the Senate because of those really close races that we're seeing in part because of Obamacare?
I think Obamacare is going to be an issue in the midterms, clearly. But it changes so rapidly. To what degree it will be determinative is still very hard to say. If you think about what the issue was 2 months ago, it was all about the shutdown, the GOP shutdown of the House and the fiscal cliff. And if you look at what the issue was the month before that, it was all about Syria. And none would have thought the issue of the day would be the ACA right now. So whether we'll still be that a year from now, I think it will still play a role. Will it be as dominant as today? Who can say? But I have a great deal of confidence, frankly, in the leadership of Harry Reid. He is one of the shrewdest, most tough tacticians there is. So I have confidence the Senate will stay in Democratic hands.
Congressman, let me just, because we're running out of time, let me just get your reaction to President Obama's comments on Friday. He seemed to signal that he's seriously considering changes to the NSA. I know that you have advocated that there be changes. What was your reaction to what you heard from the president? Have you had any communication with the White House to verify that?
I'm encouraged by what the president has said. I have not had a chance to confirm that, and I don't think the White House is sharing much of their cards yet about the kind of changes the president wants to make. But for quite a long time, I've been urging a restructuring of the metadata program precisely along the lines that the president's own task force has recommended. And I read into the president's comments about there being more than one way to skin a cat, that he is looking at that restructure very seriously. And particularly the conclusion that that task force reached that there's nothing that we can't get in a post-restructured metadata program in terms of meeting the nation's security